So we're going to talk about the shoulder and shoulder pain. Shoulder pain seems to be quite a common issue. As with most though, and most persistent pains, not necessarily serious and very rarely is it. And usually when we're looking at the shoulder and some of the complaints you have, we're probably looking at some pain within the rotator cuff itself, some inflammation, tendonitis, tendinopathies. Now the shoulder is, in my opinion, quite susceptible to overuse injuries, overload, RSI and repetition. This is probably due to the nature of the shoulder itself and the way that is made up. So the shoulder itself is not the most stable of joints. So you have the top of your arm, the head of the humerus, which creates the ball, and you have the glenoid, which is the socket, and the two go in one into the other. Now that ball and socket is very shallow. That is to enable us to have the range of motion, the range of movement we have in our shoulder, because if it wasn't, we simply wouldn't have that level of movement in pretty much all directions. So that itself can create some instability if we have a little bit of weakness there. What you then have is 4 muscles which make up your rotator cuff. Now your rotator cuff is not one thing. I think some people are under the assumption that your rotator cuff is one thing, but it's actually made up of 4 muscles. We won't go into each of those, not for the purpose of this, but the main job of those muscles is to draw the head of the humerus, the top of your arm, in towards the surface of that socket. That's where most of that stability and strength will come from, is those 4 muscles. Now, if you have tried resting it and it hasn't got better, chances are what we need to actually do is start reloading it in a nice progressive manner. Now, especially if it's more tendinous, those tissues respond better to loading than they do to resting. Tendons and ligaments characteristically have very poor blood supply, and they take longer to heal, because that is where all of your healing pretty much comes from the blood. So what we want to be doing is trying to stimulate those areas without putting too much stress necessarily through the joint and through those ranges. So usually we want to look at starting with some isometrics. So we're trying to contract those muscles, contract those tissues without putting the stress on the joint and sometimes taking you through those painful ranges. It's also important to understand that because these things aren't necessarily normally serious, we don't want to necessarily also avoid certain movements. Through that avoidance, we can then further oversensitize and protect the joint, and through that, but the pain can persist. Sometimes, we've got to just push into that a little bit, as long as we're safe to do so. But ultimately, again, if you've rested it and it hasn't got better, chances are what we need to do is actually look at strengthening up a little bit. Now, if you have rested it and it does feel better, if you return to the things you were doing before, you may be able to do that with no problems whatsoever. If you do return though and the shoulder pain returns, again, chances are what we need to do is strengthen and condition that shoulder to be able to do the things you're doing on a daily basis. Most of what we do day to day is pretty repetitious, and it's all relative. The individual may not feel that strenuous to you, some of the tasks you're doing, but if you're doing them repeatedly, potentially for hours on end or on a very regular basis, then you're still going to be susceptible to overuse injuries. So what we're going to do is look at a couple of little exercises where, just as a starting point in terms of the isometrics, that may help with that return. So first things first, find yourself a towel and find yourself a nice sturdy wall. place the towel on the wall, rolled up, and the first one you're going to do is you're going to try and externally rotate your shoulder. So you're going to try and turn that shoulder outwards into the towel. Second one you're going to do, you're going to abduct the arm or lift the arm to the side, again pushing into the towel. Now we don't need to try and push a hole in the wall, just nice and controlled. Third one we have here, we're just going to go into that forward flexion, so you're just going to push forwards into the towel. And all we're going to do is hold that for a 5 count and release. So those there should give you a nice starting point. They're all pretty gentle exercises, and again the idea is just to start contracting in those tissues and starting to use them without taking it through that range of motion through the joint, potentially just aggravating further. As with everything though, if you're not sure, then you need to reach out, or equally you need to go and see somebody so you can have that looked at and hopefully have a better diagnosis, which will give you an idea of what you need to be doing moving forward.